Hello, I'm Dr. Anthony Gonzalez. I'm a general, robotic, and bariatric surgeon down here in South Florida. I'm born and raised in Miami, went to college at the University of Miami, and went to medical school at the University of Miami School of Medicine. I've been in private practice here in South Florida at Baptist Health since the late 1990s. I am the chief of surgery at Baptist Hospital of Miami. I run the bariatric surgical program as the medical director of the bariatric surgical program for Baptist Health. And I'm the founding program director of the Minimally Invasive and Bariatric Surgery Fellowship. That is a fellowship where surgeons spend a year with me after residency to learn advanced robotic and bariatric surgery. Today, my practice is 70% general surgery. General surgery involves conditions like hernia, gallbladder, reflux, and even colon surgery. And 30% of my practice is dedicated to bariatric surgery or weight loss surgery. All of these operations are done through minimally invasive robotic approaches as my experience as a robotic surgeon. Now, let's discuss a few common conditions that I deal with on a daily basis. We're going to talk about inguinal hernia now. Hernia. What is a hernia? A hernia is a hole. I always tell my students H for hernia, H for hole. A hernia is a hole, and many people think a bulge or the ball that they see is a hernia, but actually not. What you see bulging out is your insides, maybe your guts, your intestines that are coming out through the hole. Now, an inguinal hernia is a hernia in the groin area. It could be inguinal or it could actually be femoral, which is just a few inches below the inguinal area. Now, when can you develop a hernia? A hernia can be at birth. In other words, a baby can be born with hernias. A hernia could be as a child. You could have a hernia when you're 6 years old, 8 years old, 10 years old. And then a hernia can develop in adulthood. I take care of hernias in adolescence and in adulthood. That means youngsters, teenagers as well as adults. And we're going to talk today about inguinal hernias, which are hernias in the groin. Hernias in the groin may first present as a bulge. If you notice a bulge in your groin, a lump in the groin, that may be a hernia. Hernias may present as discomfort in the groin, heaviness, pain. It's not going to be really excruciating pain unless there is a strangulation, and at that point you'd be in the hospital in the emergency room. So if you feel a bulge, you see a lump in the groin, you feel some heaviness, especially after activity, then that may be a hernia. Hernias don't bother you when you're sleeping at night, when you're resting. So if the bulge goes away when you lay down, the bulge is not present when you wake up in the morning, that is more typical of a hernia. So now you're diagnosed with an inguinal hernia. What is the treatment? Well, first there is medical treatment. There is no medication for a hernia, but if you're advanced in age, you're so ill that your doctor says you can't have surgery, then maybe you can have a hernia truss. You can order a hernia truss online and wear it. It's a belt to keep the contents inside the abdomen. But you see, a truss doesn't treat the hernia. It just kind of keeps the hernia in place until you will go up to heaven and be with God. But if you're young and if you're agile and if you're able and if you want to repair the hernia, the treatment is surgery. And hernias are closed in surgery. We close the hole. So what we do is we do robotic surgery, and I'll refer you to the robotic video to understand a little bit more about robotic surgery. We make 3 little incisions in the abdomen. We go in, we put everything back into the abdomen, all the guts back in, and we put a patch of mesh to close up the hernia. This is a mesh that we use in the inguinal hernia location, in the groin hernia. We would put one of these on each side if it's both groins that will be fixing your hernia. Hernia operation robotically takes 30 minutes to do one side, 45 minutes to do both sides. You wake up, you go home in an hour or 2 after surgery. We'll put a scrotal support on you, ice on the groin, and you go home an hour, 2 hours after surgery. You're up and around, walking, talking, moving. You can drive in a week. You can exercise in 2 weeks, and no heavy lifting for 1 month after hernia surgery. What are the complications of hernia surgery? Well, people are always concerned about bleeding and infection after surgery, but bleeding and infection is rare after hernia surgery. Infection, this is clean operation, so infections don't occur. And bleeding, even if you're taking blood thinners, will stop your blood thinners before surgery and restart them a day after surgery. So bleeding is very uncommon after this operation. What can happen is that these hernias can come back, what we call recurrence. And a recurrence of an inguinal hernia with mesh placement performed robotically is less than 5%. So there's a 95% chance you'll never see these hernias again. So in summary, a hernia is a hole. An inguinal hernia is a hernia in the groin area. It can cause heaviness, discomfort in the groin area. Treatment is robotic surgery with mesh. The recovery is quick, and you'll be able to get to your activities, play your sports, and even if you're an athlete, you'll get back to your athletic ability with rehabilitation. Once again, Dr. Anthony Gonzalez here, educating you on another surgical topic. Thank you.